Pleasure. Hello, everybody. So today I will give you a very brief overview of what is this mysterious tool, as you call it, DPAC. So the Conception Data Catalog, why we have decided within Conception Work Package to create it, how we can use it, and lastly, I would like to hear from you. So based on what you're going to hear now, you'll get to influence a little bit its development. But first of all, why we have done so? So why we have decided to create this tool? We know, so as Dave has said as well, one of the primary objectives of Conception is to optimize data collection systems as we have them now for pregnancy and for breastfeeding. So the idea is how we can do that. First of all, by understanding what's out there. So by understanding what are these types of sources of data that exist. So here I can give the example of MA holders, so companies that may have spontaneous data collection systems for pregnancy and breastfeeding. They have pregnancy cohorts, but also healthcare professionals, for example, teratology centers may have pregnancy cohorts as well. So we know that these different data sources exist, that they are different. However, there is no one source that we can trust and we can have a look at to understand, okay, what is the reality? What are these data sources that exist for pregnancy and for breastfeeding? So this is why we have created this tool. Together with Molganis, we have decided to create an electronic tool, so a user-friendly tool for everybody to have one place in which these are cataloged. So this Conception catalog is in fact an aggregate view of the description of the data sources. So how we have done so, we have created an electronic survey that we have sent, first of all, to our partners, so to companies that we know have data collection for pregnancies, and also to teratology centers. Currently, the catalog is available to the users, to the sources that have contributed with information, but in the future, we would like to open it to the public. So in this survey, we had questions, very simple, high-level questions like, okay, what is the name of your organization? What is the region that you're covering with your information? What is the starting year of your collection? Two more specific ones, like, are you collecting only negative outcomes or only abnormal outcomes related to pregnancy exposure to medication? Or are you collecting exposures as well? Are you collecting information for longer term follow-up? And so on. So all the results or the answers from this survey translate into a column as you see it here on the screen. What it's important to mention is that now no personal information would be available publicly. We are not collecting any business sensitive information. So everything that would be available in the catalog would be information that would be retrievable publicly. So in fact, how it works, how you could use it. So if you're a healthcare professional, for example, and you would be curious to learn more about a medication of your choice, and here I have taken the example of fingolimod, you could easily search the catalog so that you identify what are the sources of information that you could use. So just by typing the name of the product, you will receive the data sources that you could interrogate, so to learn more about the use of fingolimod during pregnancy and breastfeeding. What you could also do, for instance, if you're interested, maybe you're a parent, you're interested to learn more about what a TIS, a teratogen information service, would collect in terms of data for pregnancy and breastfeeding related to the exposure to a medication. You can also run a report, as you can see it right here. So then you would just click on the name of the association, and then you'll see the answers to the survey that they have populated in the questionnaire. What you can also do, and if you're more interested to learn more about the information that will be available in the catalog, very easily, an Excel report can be extracted. So in fact, you can just click and all the information would be populated in an Excel sheet, and then you can further filter it. For example, you may be interested about what would be the institutions that collect information regarding long-term follow-up. So then maybe you would like to contact them and search more, and then you will find out more regarding their data collection systems. So this is why this is a very user-friendly refill tool that can be used for understanding what's out there, in fact, because this is the first step, right? We understand the data sources, and then we learn how we can, in fact, speak the same language and how to improve the way we are collecting information for pregnancy and breastfeeding. So having heard that today, I would like to hear from you, and this information would be very useful for us